Hello friends, this video is a continuation of the important questions from the previous year OBG, and these questions are from Unit 3 and Unit 4, long essays. The first question is define normal pregnancy, and they've asked about the physiological changes that occurs during pregnancy, and they've asked in one systems wise, that is reproductive, cardiovascular, gastrointestinal system during pregnancy. So we'll see the answers. Normal pregnancy begins when a sperm fertilizes an egg, and the normal duration of pregnancy is 9 months. During this period, the body of a woman provides protection, nourishment for the development of the fetus. The pregnancy ends at delivery when a baby is born. So this is how you should define the normal pregnancy. Now we'll see the system-wise changes that occurs during the pregnancy to whatever systems they have asked. So they have asked about the reproductive system changes. So you need to write this following. So reproductive tract changes are those which occurs in the following structures like uterus, ovaries, vagina, and the breast changes that occurs during pregnancy. First, we'll discuss about the uterine changes. The uterine changes during pregnancies occurs as and when the fetal length increases and grows in size. The uterus also increases in length, depth, width, and also the weight and the wall thickness in the volume. So as you can see, the length of the uterus increases. As you can see, the length of the uterus increases from 6.5 to 32 centimeters and width from 4 to 24 centimeter, and the weight also increases from 50 to 1000 grams. And in early pregnancy, you can see the uterine wall thickens and measures about 1 centimeter to about 2 centimeters. And by the end of the pregnancy, again the wall thins to 0.5 centimeter thickness. And as you can see here, the height of the fundal, means the fundus height increases as and when the weeks of pregnancy increases. So at the end of the 12th week, the uterus can be palpated just above the symphysis pubis, and at 20 and 22nd week it will come at the level of the umbilicus, and 36th week it almost touches the xiphoid process. And for about 2 weeks before the term, that is at the 38th week, in the primary gravida woman, the fetal head settles down into the pelvis and the uterus returns to the height as it was in 36 weeks. See, the engagement of the head into the pelvis is called as lightening. So as you can see in this image, how the fundal height increases in the weeks of pregnancy. According to the weeks of pregnancy, in the 12th week you can see the fundal height as exactly at the level of symphysis pubis, and between 20 to 22 weeks you can see it at the around the umbilicus, and at the 36 weeks and about 38 weeks it is almost gone till the xiphoid process. So this is how you need to mention about the fundal height. Next, and another important thing in changes of uterus is the agar sign, which occurs at about the 6 weeks of pregnancy. What happens here is the lower uterine segments becomes so soft, and this extreme softening of the lower uterine segment is known as agar sign. So what is agar sign? Agar sign is the extreme softening of the lower uterine segment during the 6th weeks of pregnancy. We call it as agar sign. So this may also be asked for 2 marks question, like what is agar sign, or just they may ask as agar sign. Next, another important changes that occurs in the uterus is the uterine contractions, which begins at the early stages of 12th weeks of pregnancies, and it is mainly because of the tightening of her abdomen, and these are usually painless uterine contractions, and these are called as Braxtonic contractions. So these are called as what? These are called as Braxtonic contractions. Next, another important changes or event that occurs in the uterus is amenorrhea. It is the absence of menstruation that occurs during pregnancy. It is mainly caused because of raising estrogen levels. Next is the cervical changes, that is, you can see this, there is a softening of the cervix during pregnancy and is called as a Goodell sign. Next is the vaginal changes. In the vaginal changes, you need to write that there is an increased vascularity of the vagina, and also there is a changes in the color of the vaginal walls from normal light pink to deep violet color, and this is called as Chadwick sign. So whatever I am telling you now, that is Eggar sign, Braxtonic contraction, and this Chadwick sign can also be asked for 2 marks questions. Now, next is about, you have to write is ovarian changes, that is ovulation stops with the pregnancy. Next is ovarian changes, that is, as I already told you, ovulation stops with the pregnancy. It's mainly because of the feedback mechanism of estrogen and progesterone produced by the corpus luteum early in pregnancy, and which is replaced by the placenta in the later pregnancies. The next important changes in the reproductive system is the changes in the breast. The changes in the breast, that is, the mother may experience feeling of fullness, tingling sensations, and tenderness in her breast. And as the pregnancy progresses, the breast size also increases. And by 16th week, colostrum, the thin, watery eye protein fluid, can be expelled from the nipples. So this is the changes in the breast that occurs during the pregnancy. After the reproductive system, you remember in the question they've asked you about the cardiovascular system. So you need to write the changes that occurs in the cardiovascular system. So that is, you need to mention about the blood volume and the blood loss that occurs during the vaginal birth. So the blood volume, the total circulatory blood volume of the woman's body increases by at least 30% during pregnancy. And the blood loss at the normal vaginal birth is about 300 to 400 ml. The blood loss that is occurred during the cesarean birth can be high as 800 to 1000 ml. And you can see the woman's cardiac output also increases, and heart rate increases by 10 beats per minute, and the diaphragm is pushed upwards because of the growing uterus in the later pregnancies. And in the blood pressure actually decreases slightly during the second trimester, just mainly because of peripheral resistance to circulation. It's also lowered as the placenta expands rapidly, and during the third trimester you can see the blood pressure raises again, same like the first trimester. Next, you need to mention about the supine hypotension syndrome in the cardiovascular system. That is, when the pregnant woman lies in the supine position, the weight of the growing uterus presses the vena cava against the vertebra, resulting in obstructing blood flow from the lower extremities. So what happens here is the woman experiences the hypotension when she is lying down in the supine position, and it can be manifested like lightheadedness, faintness, and palpitations. And it can be usually be corrected by making the woman to turn on to her left side or any other side, but preferably on the left side. By making the mother to lie down on the left side, we can help her from getting this hypotension. Why does hypotension occur? It is mainly because of the vena cava is getting compressed here. Next, I will ask you about the changes that occurs in the gastrointestinal system. So 50% of the women, as you know, they experience nausea and vomiting during pregnancy, and is most apparently in the early morning. And this common feeling of nausea usually subsides after 3 months. The second question they asked is, define normal labor, list the stages of labor, and write in detail about physiological changes during first stage of labor. So now we'll see the answers. So the normal labor is a series of events that takes place in the genital organs in an effort to expel the viable products of conception out of the womb through the vagina into the outer world is called as normal labor. So normal labor is a series of events that takes place in the genital organs in an effort to expel the viable products of conception out of the womb through the vagina into the outer world is called as normal labor. So as you should know the stages of labor, the first stage is from the onset of true labor pains till the full dilatation of cervix, and it is usually 12 hours in primary gravida and 6 hours in multipara. So the first stage is the from the onset of the true labor pains, true labor pains till the full dilatation of the cervix, and it is about 12 hours in the primary gravida and 6 hours in multipara. The second stage is from the full dilatation of the cervix till the fetus is delivered, and it's about 2 hours in primary gravida and 30 minutes in multipara. And the third stage is from delivery of the fetus till the delivery of the placenta. It's an average of 15 minutes in primary gravida. The fourth stage is usually an observation stage for at least 1 hour after the expulsion of all the products of conception. And during this period, we'll observe for the general condition of the patient and also the behavior of the uterus, means whether the uterus is getting contracted and going back to the normal shape and position, and also we'll see carefully whether the bleeding is increasing or any products of conception is being left behind. So we will have a careful observation of bleeding and also the general condition of the mother. So in the question you have seen that they have asked about the physiological changes that occurs in the first stage of labor. We'll see what it is. The first stage of labor starts with the onset of the labor pains till the full dilatation of the cervix, and I already told you it is about 12 hours in primary gravida and half the time of the subsequent deliveries. So we'll see what are the physiological changes that occurs during the first stage of labor. Usually the uterine contractions and retractions starts, and the longitudinal muscle fibers of the upper segments attached with the circular muscle fibers of the lower segment and the upper part of the cervix in a bucket holding fashion. That means the muscles which was holding the uterus in this form, as you can see here, that during pregnancy it will be in this form, and when the labor starts it expands itself to release the products of conception outside. Next is the bag of membranes. Here that means the membranes which are attached loosely to the deciduum, that is the lining of the uterine cavity, over the internal os. In the vertex presentation, the girdle of the head fit into the lower uterine segment and divides the amniotic cavity into two parts, that is the forewater and the hindwater. This generates the hydrostatic pressure and dilates the cervical canal. So what happens here is, see here the membranes whichever is attached to the lining of the uterus, except in the lower part, except in this lower part of the cervix, divides this amniotic sac into two divisions. Okay, it is a forewater and the hindwater. So what, because of this there is an increased amount of hydrostatic pressure. This hydrostatic pressure whatever is there here, it helps in dilating this cervix. Next we need to know is about the fetal axis pressure. The longitudinal line, there is a straightening out of the fetal vertebral column due to the contractions of the circular muscles in the body of the uterus. See, as you can see here, the pressure exerted on the fetal vertebral column makes the means whatever pressure is being exerted here is also seen here. Okay, seen here, that is a pressure is also felt on the circular muscles. On the circular muscles also gets contracted also gets contracted, which in turn exerts the pressure. This pressure is felt over here, that is in the cervix, in the cervical canal, so which makes the cervix to get dilated. And next is effacement. In effacement is the muscles whichever is present towards the upward cervix merges with the lower segment of lower uterine segments. This is called as effacement. So that is what is happening in the first stages of labor. So what happens in the lower uterine segment here? As and when the labor progresses, it makes the upper wall of the segment becomes thickened, whereas the lower segment becomes thin. So as you can see here, the upper segments of the uterus becomes thick and the lower segments becomes thin. So this makes the division between this upper and the lower segment, and this makes the formation of a ring. Okay, makes the formation of a ring here, and this ring is called as a physiological retraction ring. It is mainly caused by the division of this uterus into the upper and the lower segments. That is, the upper segment becomes thick and the lower segments become thin, making it to get a constriction at one place. Okay, and this ring, the formation of this ring is called as a physiological retraction ring. So how will you take care of the mother during the first stage of labor? Nursing care. The nursing care usually begins from the time of hospital admission. Okay, first of all we need to have a good rapport with the patient and other members who are with the patient, and also ask her to remove the nail polish from the hands and remove any jewelries and hand over the belongings to the significant relatives. Change the clothes of the woman according to the hospital policy. And next we should mainly concentrate on taking histories, that is the present labor, name, and when the labor pain started, whether the membranes are ruptured or intact, and frequency and strength of the contractions to be asked. We also ask about the past history here, whether what is a parity, and also will ask about the characteristics of the previous labor, whether the previous labor was a normal one, also cesarean, or any other complications that arise during pregnancy or labor. And also we'll note about the weight and the condition of the previous babies, and evidence of any cephalopelvic disproportion during the last labor, also about any maternal disease, and also about RGUHS immunization. Next important thing that you need to do is the perineal preparation, that is a shaving of the pubic hair to prevent infections. And also we need to give enema. Why enema is given? It's mainly it stimulates uterine contractions, and also it helps in the prevention of contamination that happens because of the fecal matter at the time of delivery. Okay friends, this is about the important questions from the unit 3 and 4, 10 marks question. Meet you all in the next video. Thank you so much for your patient listening.